Pneumonia, yes, there's a million different kinds of pneumonia. So community-acquired pneumonia. So community-acquired pneumonia, community-acquired pneumonia is pneumonia that is diagnosed in somebody who has not been hospitalized or not been in like a long-term acute care facility for the past 14 days. So if you've not been hospitalized in 14 days, you come down with pneumonia, it's considered community-acquired pneumonia. If a lot of times we don't admit pneumonia, it just depends on a lot of different things. So age, comorbidities, chronic medical problems, comorbidities, if they have really icky vital signs, if they have mental status changes, or if they have failed outpatient treatment, then we'll admit them. So by failed outpatient treatment, I mean you've been on antibiotics for 2 or 3 days and you're getting worse, or you're just not getting any better at all. We consider that failed outpatient treatment, and then you're admitted for that. We treat them with empiric antibiotics. So what does an empiric antibiotic mean? Well, empiric just basically means our best educated guess. This is what we think is going to work. Because a lot of times we don't have a culture that we can definitively say this is the antibiotic you need to be on. So we usually put them on more of a broad spectrum antibiotic, or just the antibiotic that we really think is going to take care of this particular pneumonia, or just pneumonia in general. Hospital-acquired pneumonia. So any kind of hospital-acquired infection is considered a nosocomial infection. So a hospital-acquired pneumonia or a nosocomial pneumonia is one that has been diagnosed in a patient who's been in the hospital at least 48 hours. So in that first 48 hours, if we diagnose you with pneumonia, you probably got it before you ever came to the hospital, and so the hospital doesn't get blamed for it. If after 48 hours it is considered a nosocomial infection and it's the hospital's fault you got pneumonia, unless you're on a ventilator. And if you're on a ventilator, then it's a whole different kind of pneumonia. It's still a nosocomial pneumonia, but it's considered a ventilator-acquired pneumonia. I know my group kind of talked about that in post-conference. Ventilator-acquired pneumonia is because you've got this airway going straight down into your trachea, this artificial airway going down into your trachea. Your mouth is a rich source of bacteria, and so it's easy for bacteria to get in there and cause you pneumonia. So you'll see respiratory and nursing doing a lot of oral care to try to prevent that. In your patients who have a hospital-acquired pneumonia, they got it while they were in the hospital, we're going to treat them with antibiotics. We'll try to get a sputum culture from them, and we will start out with broad-spectrum antibiotics. Again, the broad spectrums, if you remember from Pathopharm, I know a long time ago you probably have PTSD from that course and are trying to forget everything you ever learned in Pathopharm, but the broad-spectrum antibiotics are the ones that kill your gram-negative and your gram-positive stuff until you can get a sputum culture and figure out if this is actually gram-positive or gram-negative, so you can give a more specific antibiotic. So you're going to give them antibiotics, so some of the risk factors for your hospital-acquired pneumonia is just basically being hospitalized. So you're already compromised in some way, you're in the hospital, and now you develop pneumonia. Aspiration pneumonia is when something that's not supposed to be in your lungs from your mouth or your stomach ends up in your lungs. So you've either vomited and sucked it down into your lungs, you were eating food and you sucked it down into your lungs instead of sucking it down into your stomach. So basically anything that should be in your stomach but now it's in your lungs, that's bad. Anybody with an altered level of consciousness, people who've had anesthesia, that's why anesthesia likes you to be NPO forever before they do surgery on you because they don't want stuff coming up. Altered level of consciousness, anesthesia, head injuries, strokes, people who are under the influence of alcohol, all those things can impact your ability to control your airway, and so you can suck stuff down into your airway that's not supposed to be there. Again, we normally treat this with broad-spectrum antibiotics that will kill both your gram-negative and your gram-positives. Necrotizing pneumonia, that sounds really gross, and it really is. Basically, you get this like liquefaction, liquidy. Your lungs kind of turn into liquid junk. So, or you get big holes or cavitations into your lungs, and it's a rare complication from a lung infection, so probably won't see it very often. It's usually a result of a community-acquired pneumonia that went bad. So they've got respiratory insufficiency. They may have respiratory failure. They can actually even have some bleeding into their airways. So we treat this with long-term antibiotics. So they're not just going to be on antibiotics for 7 to 14 days. They're going to be on antibiotics for months. And if it's really bad, then they may end up having to have some kind of surgery to fix, either fix the cavitation or try to get rid of some of the bacteria that's in there through a surgical means. Opportunistic pneumonia is the kind of pneumonia that you see in patients who are immunocompromised, and so again, it's infection of your lower respiratory tract, and it's what you see in immunocompromised patients. So your patients with HIV, your patients with cancer, anybody who's immunocompromised. So immunocompromised is opportunistic. Aspiration is when I suck something into my lungs. It should have been in my stomach. Hospital acquired is a pneumonia that developed after you've been in the hospital for 48 hours. And then community acquired, I got it when I haven't been in the hospital in the past 14 days. So hope that helps you kind of understand the different kinds of pneumonia.